Donation after cardiac death, or so-called DCD donors, involves removal of organs once the heart stops. Patients that have end-stage liver disease, where they have symptoms of liver disease that are life-threatening, can obtain an appropriate donor organ either through patients who have had brain death and have already been pronounced dead, and we can remove the organs one by one after preserving them. Another situation is where patients have had a severe brain injury and it's been decided that they will never be able to wake up, but they can be again used in appropriate patients. DCD liver transplantation was first started about 25 years ago. Really the last 10 years, two main breakthroughs have been determined. One was to determine exactly how long the heart can be stopped and then preserved, and that length of time is about 10 to 15 minutes. With that, the organs can work very well. The second aspect was what kind of patient to put this donor organ into, using appropriate preservation techniques, and then putting them into patients that are not quite so sick. The results approach that of regular donation techniques. It used to be that about 80% of the organs would actually work, but now it reaches up to around 92%, which is very close to the regular approach that we have. The second is that the survival used to be about 88% at 1 year, and now it's up to about 94%, which also approaches the average. So the results approach very close to our usual technique of preservation. We encourage all of our recipients to consider donation after cardiac death as the origin of their donor. All the patients may not qualify for this. Again, as we discussed previously, the donor organ needs to have just a minimal amount of injury at the time that the heart stops. On the other hand, again, patients who are not quite as sick as the top of the transplant list can get their transplants safely. Most of the patients that we transplant have very high MEL scores in both all the blood types A, B, O, and AB. Because these organs for DCD donation is into lower, what they so-called MEL scores, or much less sick patients. These patients who have MEL scores around 25, 26 and lower, they can jump the click in the organ donation by taking this slightly increased risk of problems after transplantation, but we would use those organs in this group. So probably transplanted faster and maybe before they become much more ill. As I always tell the patients, we're only going to use organs in situations where we think they're going to work. We're not going to take any chances with your success after transplant. But it has to be in a special situation to consider you, but we recommend that you look into that. In reviewing if we should use a liver donor organ in transplantation, we look at the laboratory tests to see if there's been any injury based on measuring liver enzymes. We also look at any damage that could have been to the liver, as in such as a car accident. We do a CT scan imaging. We also make sure the liver is functioning and that it's making its coagulation factors appropriately. Those are the few things that we use to evaluate these donor organs. Liver transplantation, even in this most significant time of coronavirus, is still safe. We test out the organs for almost every kind of viral illness, including the COVID-19 virus. And so it's safe to use these organs, and we've been doing that really since February when it first began. The organs are tested every way, including liver biopsy sometime, in order to make sure that the organs are safe for the patients. Liver transplantation is probably the biggest, longest, most blood loss operation there is. And The liver transplant program at the Methodist Specialty Transplant Hospital for the last decade has had the best one-year patient survival. Most recently, the scientific registry for transplant recipients shows that we have the best 3-year patient survival at around 95%, which is close to the best results in the history of transplantation. The Methodist Hospital, especially in transplant, is the only hospital in the world that has the word transplant in it. And with that, it shows that we have a very specialized approach. Both the liver, kidney transplant, pancreas transplant programs have stellar results, and all of the doctors at this hospital specifically want to be here to take care of transplant patients. And that's not the case anyplace else in the world. I helped start the program 20 years ago. I'm very proud to be here, and almost every year we've had the best results in Texas, and at times the best results in the United States. I get up every day trying to make sure that we have the best results and the best care of the patients.